Madam Undersecretary and other guests, thank you very much for inviting me to speak here today. My children told me to get into the 21st century, and so I've traded my old assistive devices, my glasses, for an iPad where I can increase the font size and not have to worry about it. So it's actually quite marvelous. And I'm like Venus, I'm slowly becoming attached to it, and I can't do anything without it. Yes. At USAID, my job focuses on preventing, promoting, and protecting the human rights of vulnerable populations. We often find that people with disabilities are more vulnerable in comparison to others, especially in crisis or conflict situations. The World Report on Disability reinforces this fact. I'm proud of the leadership that USAID has demonstrated in this area, especially in trying to ensure that disability is woven across all of our broad development objectives, from democracy and governance to economic growth, and from food security to education, and of course in health. Proudly, two of those initiatives that I manage, the War Victims Fund and the Wheelchair Program, are supporters of many of the activities related to this side event. USAID is proud of the association with the World Health Organization, with the International Society for Prosthetics and Orthotics, and others to promote access to assistive technology. We recognize that assistive technology has two equally important components: the product, the devices themselves, but also the service provision. And we realize that besides the non-availability of assistive devices, there is also a great scarcity of appropriately trained human resources who can ensure quality service provision, especially in low-income countries. As a result, we have invested heavily over the past 15 years to facilitate consensus conferences, develop normative guidelines and training packages, develop human resources, capacity building of training institutes, and train personnel to improve service provision related to AT with one goal: people with disabilities have access to social, economic, cultural, and political equality. After all, it's not about the technology, it's about the person. I'm proud of the strong USAID-WHO relationship, and I believe that it is the World Health Organization who can bring various stakeholders together, like this event, and influence and support member states to ensure greater access to high-quality, affordable assistive technology. I understand that ensuring the availability of high-quality, affordable technology, health technology, is one of WHO's key priority areas in the coming years. So we're at the right place at the right time. It is my great privilege and honor to be here at this event, and I believe that we need to develop a global initiative to improve access to assistive technology. Several articles of the Convention on the Rights of Persons with Disabilities ask that member states ensure greater access to assistive devices, and the 134 countries that have ratified the Convention are now morally and legally obligated to ensure access to assistive devices as a fundamental right. But to realize this, the member states, especially low and mid-income countries, need support from the international community. Article 32 of the Convention specifically notes the importance of international cooperation to improve access to assistive technology, and I think this event is an ideal platform to lay the foundation for more global cooperation. Perhaps it's a bit presumptuous, but I believe that WHO has the proven leadership to spearhead such global cooperation. And I'd like to say that USAID stands beside you and would do all that we can to help realize a world where everyone has access to needed assistive technology. Thank you.